This conference will now be recorded.
Today's topic is anatomy of the lacrimal apparatus. Lacrimal apparatus mainly consists of the glands which produces the tear fluid and drainage of the lacrimal fluid. Lacrimal fluid, tear fluid is produced by the lacrimal glands. It is divided into mainly the orbital part and the palpebral part. The two main parts of the lacrimal gland are orbital part and the palpebral part. The part is larger and is almond shaped. Palpebral part is 1/3 of the orbital part. And drainage of the tear fluid occurs through the puncta, lacrimal puncta. Through the lacrimal puncta, it reaches the lacrimal canal. Through the lacrimal canal, it reaches the lacrimal sac. Through the lacrimal sac to nasolacrimal duct. From nasolacrimal duct, it enters the inferior meatus of. This is the pathway of drainage of the tear fluid. It is produced by the lacrimal glands, which consists of two parts, orbital part and the palpebral part. And the tear fluid produced, it helps in the lubrication of the eye, and excess tear fluid it drains through the lacrimal puncta, through the lacrimal canal and common canaliculi into the lacrimal sac, and to the lacrimal nasolacrimal duct. It opens into the nose at the inferior meatus. Lacrimal sac is divided into three parts: the fundus, the middle part, and the neck. From the neck, there will be nasolacrimal duct. This is the anatomy of the lacrimal apparatus. Mainly consists of the lacrimal glands, punctum, canals, common canal, canaliculi, and the lacrimal sac, which is divided into three parts: fundus, the middle part, and the neck of the lacrimal sac, and nasolacrimal duct, which opens into the inferior meatus of the nose. The lacrimal apparatus comprises the structures concerned with the formation of the tears, the main lacrimal gland, and the accessory lacrimal glands. Accessory lacrimal glands are two: glands of Krause and glands of Wolfram. Glands of Krause, they are located in the superior fornix, mostly superior fornix. Few of them are located in the inferior fornix, predominantly in the superior fornix under the palpebral conjunctiva. Wolfram, they are situated above the superiorly above the upper tarsus, inferiorly below the inferior tarsus, lower tarsus. These are the Wolfram, glands of Wolfram. The lacrimal passage, the pathway of drainage of the lacrimal fluid includes the puncta through the canaliculi. From the canaliculi, common canaliculus, from there it drains into the lacrimal sac. From there to the nasolacrimal duct. This is the lacrimal passage: puncta, canaliculi, two canaliculi, superior canalicus and inferior canalicus, lacrimal sac, and the nasolacrimal duct. So this is the lacrimal apparatus. This is the puncta, superior punctum. This is the inferior punctum. This is the upper canalicus. This is the lower canalicus. This is the common canalicus. The common canalicus opens directly into the body of the lacrimal sac. This is the body of the lacrimal sac. This is the fundus of the lacrimal sac. And it opens into the inferior meatus of the nose. This is the nasolacrimal duct. And lacrimal gland is divided into orbital part which is present above the LPS muscle, and this is the palpebral part. Through the palpebral part, the lacrimal duct travels and opens into the lateral part of the superior. This is the upper fornix. This is the inferior fornix. This is the orbital part of the lacrimal gland. This is the LPS muscle. This transverse separation, which is separating the orbital part from the palpebral part, is called LPS muscle. This is the palpebral part. These are the ducts which traverse through the palpebral part of the lacrimal gland. These ducts, they pass through the palpebral part of the lacrimal gland. The ducts opens into the superior fornix, predominantly into the superior fornix. Some of them opens into the inferior fornix. Mainly they open into the superior fornix. This is the superior canaliculus. This is the punctum. This is the lower punctum. This is the inferior canaliculus. This one is the common canaliculus. This is the lacrimal sac, fundus, body, and the neck. From the neck, there will be nasolacrimal duct. This is the nasolacrimal duct, which starts from the neck of the lacrimal sac. This is the neck of the lacrimal sac. From there, the nasolacrimal duct. This entire thing is the nasolacrimal duct. This is the inferior meatus. The nasolacrimal duct opens into the inferior meatus of the nose. So excess of the tear fluid will drain from through the puncta into the canaliculus, common canaliculus, into the lacrimal sac, into the nasolacrimal duct, from there into the inferior meatus of the nose. Lacrimal glands. This is the orbital part of the lacrimal gland which lies above the LPS muscle. This is the orbital part of the lacrimal. It mainly consists of two parts, orbital part and the part. Main lacrimal gland situated in the fossa of the lacrimal gland, formed by the orbital plate of the frontal bone in the anterolateral part of the roof of the orbit. It is located at the roof of the orbit, anterolateral part of the roof of the orbit. The main lacrimal gland is situated at the anterolateral part of the roof of the orbit. This is the anterolateral part, roof of the orbit. The gland is divided in the anterior aspect by the lateral horn of the apparatus of the LPS muscle into superior orbital and inferior orbital. Superior orbital and inferior palpebral part. There are two parts I already said. The superior part is the orbital part and inferior part is the palpebral part. The main gland is divided into orbital and palpebral part by the LPS muscle. Lateral horn of the LPS muscle. This is the orbital part of the lacrimal gland. This is the main part. This is the palpebral part, which constitutes about the 1/3 of the orbital part. Through the palpebral part, the main ducts of the lacrimal gland traverse through the palpebral part of the lacrimal gland. This is the LPS muscle. It separates this LPS muscle, lateral horn of the LPS muscle separates the orbital part from the palpebral part. This is the lacrimal gland, which is situated at the superolateral part of the orbital margin. This is the superolateral part of the orbital margin. Lacrimal canaliculus, it consists of the vertical part and the horizontal part. This is the vertical part. This is the punctum of the punctum. This is the upper punctum and this is the lower punctum. This is the vertical part of the lacrimal canal and this is the horizontal part. Here also this is the vertical part and this is the horizontal part. Both of them opens into the lacrimal sac. This is the fundus of the lacrimal sac. This is the body and this is the neck and this is the nasolacrimal duct. And lacrimal gland consists of the orbital part and the palpebral part. Through the palpebral part, the lacrimal ducts travels and opens into the superior fornix. The orbital part and lacrimal part are divided by the LPS muscle, lateral horn of the LPS muscle. The orbital part of the lacrimal gland, it is large, about the size of the shape of the small almond, Superior surface, it is convex and lies in contact with the periorbital lining the part of the frontal bone forming the fossa of the lacrimal gland. It lies in the fossa of the lacrimal gland. It is attached to the periorbital by the fine trabeculae. The superior surface of the orbital part is attached to the periorbital by fine trabeculae. The inferior surface, superior surface is convex. It has two surfaces, two extremities and two margins, lateral margins and median margins. Lateral extremities and medial extremities, two borders, anterior border and posterior border. Anterior border is sharp and is parallel to the orbital margin up to the zygomatico-frontal suture. It lies in contact with the septum orbital. Posterior border, it becomes continuous with the orbital part of the gland. It lies in contact with the orbital part of the gland. Extremities, lateral extremity, it rests on the lateral rectus muscle. Middle extremity is related to the LPS muscle. Lateral extremity is related to the lateral rectus muscle. Middle extremity is related to the LPS muscle. It has two surfaces. The orbital part has two surfaces, two borders, and two extremities. The two surfaces are superior surface and the inferior surface. Superior surface is convex and lies in contact with the frontal bone, forming the fossa of the lacrimal gland. Inferior surface is concave and lies above the LPS muscle, lateral horn of the LPS. And two borders, anterior border is sharp and lies in parallel with the orbital margin up to zygomatico-frontal suture. It lies in contact with the septum orbital. Posterior border becomes continuous with the palpebral part of the lacrimal gland. It lies in contact with the orbital side. It has two extremities. Lateral extremity, it rests on the lateral rectus muscle. Middle extremity rests on the LPS muscle. It relates to the LPS muscle. Two surfaces, two borders, and two extremities. The orbital part has two surfaces, superior surface which is convex, inferior surface which is concave, and two borders, the anterior border which is sharp and lies in parallel to the orbital margin up to the zygomatic suture. Posterior border, it becomes continuous with the palpebral part of the lacrimal gland, and two extremities, lateral extremity which lies on the lateral rectus muscle, middle extremity which is related to the LPS muscle. Two surfaces, two borders, and two extremities. That is about the orbital part of the lacrimal gland. This is the palpebral part of the lacrimal gland. The palpebral part of the lacrimal gland, it is small in size. It is about 1/3 of the size of the orbital part. Three lobules situated in the upon the course of the ducts of the orbital part of the, which is separated from the orbital part by the LPS muscle. It is situated in the course of the ducts of the orbital part and is separated from the orbital part by the LPS muscle. Superiorly, it is related to the LPS muscle. Inferiorly, it is related to the superior fornix. Posteriorly, it is continuous with the orbital part of the lacrimal gland. Posteriorly, they are continuous. Both orbital and palpebral part, they are continuous posteriorly. Only in the middle, they are separated by the LPS muscle. Inferiorly, it is related to the superior fornix. Superiorly, it is related to the LPS muscle. Because orbital part and palpebral part are separated by the LPS muscle. This is the LPS muscle, which is separating from the orbital part from the palpebral part. These are the ducts of the main gland, orbital gland, which travels through the palpebral part and opens into the superior part. Superiorly, it is related to the LPS muscle. Inferiorly, it is related to the superior fornix. Posteriorly, it becomes continuous with the orbital part of the, here you can see. Posteriorly, the palpebral part becomes continuous with the orbital part of the lacrimal gland. Posteriorly, they are both are continuous. Only in the middle, they are separated by the LPS muscle. This is the orbital part. This is the palpebral part. They are continuous with one another posteriorly, but anteriorly, they are separated by the LPS muscle. This is the LPS muscle. This almond shaped is the orbital part. This small one is the palpebral part, which becomes continuous with one another posteriorly, but anteriorly they are separated by the LPS. Ducts of the lacrimal gland, total 10 to 12 in number, passes downwards from the main gland to open in the lateral part of the superior pharynx. The lacrimal ducts opens into the lateral part of the superior pharynx. 1 to 2 ducts also open in the lateral part of the inferior pharynx. Histology, lacrimal gland is branched tubulo-alveolar serous acinous gland. Microscopically, it consists of glandular tissue, stroma, and septa. It is surrounded by the periaorta as the outermost limb. The glandular tissue consists of acini ducts arranged in lobules separated from each other by a fibrovascular septa. The acini are lined by a single layer of pyramidal cells mounted on a basement membrane. The pyramidal cells are also serous type with eosinophilic secretory granules and round nucleus situated towards the base. These cells secrete tears which is expelled out by the ducts. The pyramidal cells secrete the tears. The stroma of the gland is found by the mesodermal tissue which contains connective tissue, elastic tissue, lymphoid tissue, plasma cells, rich nerve terminals and blood vessels. This is the anatomy. It consists of the duct, this is the ductule, and these are the acinas. These three are the acinas. Lacrimal consists of duct, ductules, and the acinas. This is the one acinus, this is the other acinus, this is another acinus. These are acini. This is the duct, this is the ductule, and these are the acini. It is predominantly a glandular tissue. Acini cells synthesize and secretes proteins, electrolytes, and water. The ductal modifies the electrolyte composition. The myoepithelial cells synthesize basal membrane, contractile in function, maintains integrity of the acini. Main lacrimal gland is supplied by the lacrimal artery, which is a branch of ophthalmic artery. Sometimes the branch transfers the facial artery, may also branch of the transverse facial artery also may supply the gland. It is predominantly supplied by the lacrimal artery, a branch of ophthalmic artery. Sometimes it may be also supplied by the transverse facial artery, a branch of the transverse facial artery. Lacrimal artery is the main blood supply, which is a branch of ophthalmic artery. Nerve supply is also same. Lacrimal nerve, which is a branch of ophthalmic division of the trigeminal nerve. Lymphatic drainage is along the conjunctival drainage into the it drains into the preauricular lymph nodes. It mainly drains into the preauricular lymph nodes. Sensory nerve supply, lacrimal nerve, a branch of ophthalmic division of the fifth nerve. Sympathetic nerve supply, carotid plexus of the cervical sympathetic fibers. Sectomotor fibers, they are derived from the superior salivary nucleus, which is present in the pons. Accessory lacrimal glands includes glands of Krause, glands of Wolfram, infraorbital glands, glands in the caruncle, and plica semilunar. These are all the accessory lacrimal glands. Out of which the glands of Krause, glands of Wolfram are important. Glands of Krause, they are located in the superior fornix. They are separated in the superior fornix under the palpebral conjunctiva. Wolfram, they are situated above the superior border of the tarsus, inferiorly below the inferior tarsus. Infraorbital glands, glands in the caruncle and plica semilunar. Glands of Krause, they are microscopic glands lying in the subcutaneous tissue of the fornixes. They are 42 in number in the upper fornix and about 6 to 8 in the lower fornix. They are mainly present in the upper fornix. The number is about 40 in the upper fornix, 6 to 8 in the lower fornix. They are subcutaneous tissue of the fornixes. Glands of Krause are located in the subcutaneous tissue of the fornix. Glands of Wolfram, they are microscopic glands present along the upper border of the superior tarsus, 2 to 5 in number, and lower border of the inferior tarsus. They are present in the upper border of the superior borders and lower border of the inferior tarsus. They are about 2 to 3 in number. Whereas glands of Krause, they are superiorly 42 in number. Inferior fornix, they are about 6 to 8 in number. Rudimentary accessory glands, they are present in caruncle, plica semilunalis, and infraorbital margin. These are the glands of Purkinje, which is present in the subrenal tissue in the superior fornix. Glands of Wolfing, they are present above the superior tarsus. This is the superior tarsus in the upper lid, below the inferior tarsus in the lower lid. These are the glands of Purkinje. These are the glands of Wolfing. This is the accessory lacrimal gland. This is the glands of Purkinje. This is the main lacrimal gland. These are the glands of Wolfing. They will be here above the superior tarsus. These are the meibomian glands, which opens into the skin. Lacrimal passages, same again. Orbital part of the lacrimal gland. This is the palpebral part of the lacrimal gland. These are the lacrimal ducts which traverse through the palpebral part of the lacrimal gland. This is the superior fornix. This is the inferior fornix. The tear fluid which is secreted will pass through the superior punctum, inferior punctum, superior canalicus, lower canalicus, common canalicus, lacrimal sac, fundus, body and neck. This is the lacrimal. This is the drainage of the tear fluid. Lacrimal puncta, these are all two small rounded oval openings, one on each on the upper and lower eyelid. They are located one each on the upper and lower eyelid at the junction of the ciliary and lacrimal portion of the lid margin. Situated upon a slight elevation called lacrimal papillae. Lacrimal puncta are situated upon a slight elevation called lacrimal papillae. The upper punctum is 6 mm and lower punctum is 6.5 mm lateral to the inner canthus. They are situated at a distance of 6 mm superiorly and 6.5 mm lateral to the inner canthus. The punctae are surrounded by the ring of dense fibrous tissue which keeps them patent. They should be patent. If they collapse, they will be epiforum. So that is why the puncta is surrounded by the dense fibrous tissue. This is the lacrimal punctum, which is situated about 6 mm away from the medial canthus. This is the medial canthus. It is about 6 mm from the medial canthus. This is the papillae above which the lacrimal punctum. This is the opening. This opening is called the lacrimal punctum. Here also you can see the papillae, and it contains the opening. The superior lacrimal canaliculi are divided into superior canalicus and inferior canaliculi. The superior canaliculi, inferior canaliculi join the puncta into the lacrimal sac. Each canaliculus is 0.5 mm in diameter and has two parts. The vertical part is the length of the vertical part is 2 mm. The horizontal part is 8 mm, which lies at right angles to each other. The vertical part and the horizontal part, they lie at right angles to each other. At the junction of two portions, there is a slight dilatation called the ampulla. This is the vertical part. This is the horizontal part. And this is the common canalicus. This is the lacrimal fundus of the lacrimal sac. This is the body of the lacrimal sac. This is the neck of the lacrimal sac. And this is the nasolacrimal duct. The size of the nasolacrimal duct is about 12 to 18 mm. And the lacrimal sac is about 12 to 15 mm. The size of the lacrimal sac is 12 to 15 mm. And nasolacrimal duct is 12 to 18 mm, which opens into the inferior meatus. This is the inferior meatus of the nose. There is a small valve which controls the entry of fluid into the nose. That small valve which is present is called hiatus semilunaris. The small valve which is present at the opening of the nasolacrimal duct into the inferior meatus is called the hiatus semilunaris. And the small valve which is present at the junction of the opening of the common canaliculus into the lacrimal sac is called valve of Rosenmuller. The valve present at the opening of the common canaliculus into the lacrimal sac is called the valve of Rosenmuller. This is the vertical part. This is the horizontal part. This is the common canaliculus. This is the valve of Rosenmuller, which controls the entry of tear, prevents the reflux of the fluid from the lacrimal sac into the canaliculus. Each canaliculus pierces the lacrimal fascia separately and then unite to form a common canaliculus, which opens in a small diverticulum of the sac called lacrimal sinus of Meyer. The point of opening into the sac lies at the middle of the lateral surface of the sac, about 2.5 mm from its apex. Structures layers of the canaliculus, inside to outside. Inside it is lined by the stratified squamous epithelium, corium rich in elastic tissue, which makes its wall stretchable and can be dilated to about 2 mm while passing the probe. Fibers of the orbicularis which surround the corium of the canaliculus are called pars lacrimalis. This is the vertical part. This is the horizontal part. The size of the vertical part is about 2 mm and the size of the horizontal part of the canaliculus is about 8 mm, and the junction between the vertical part and the horizontal part, this junction is called the ampulla. This is the common canaliculus which opens into the lacrimal sac. Lacrimal sac, it lies in the lacrimal fossa, located in the anterior part of the medial wall of the medial orbital wall. The lacrimal fossa is formed by the lacrimal bone and the frontal process of maxilla. It is mainly found by the two bones, lacrimal bone and the frontal process of maxilla. It is bounded by the anterior and posterior lacrimal crusts. Dimensions: the lacrimal sac when distended is about 15 mm in length and about 5 mm in width and capacity of 20 cubic millimeters. When distended, length is about 15 mm and width is about 5 mm and capacity of 20 cubic millimeters. The lacrimal sac is enclosed by a lacrimal fascia, which is a part of periorbita. The periorbita is nothing but the periosteum lining the orbit is called the periorbita. The periosteum lining the orbit is called periosteum. Periorbita. It splits at the posterior lacrimal crust into two layers, which enclose the sac and again meet at the anterior. It splits into two layers. The periorbita is nothing but the periosteum lining the orbit. It splits at the posterior lacrimal crust in two layers, again meets at the anterior lacrimal crust. The lacrimal fundus, the three parts of the lacrimal sac: fundus above the opening of the canaliculus, body at the middle part. The size of the length of the fundus is about 5 mm and the body is about 10 mm. Neck or lower small part, which is narrow and continuous with the becomes continuous with the nasolacrimal duct. Medially, it is related to the anterior ethmoid sinus in the upper part. Middle meatus of the note is in the lower part. Anteriorly, lacrimal fascia and few fibers of the inferior oblique muscle. Medial palpebral ligament, which covers only the upper part of the sac. Angular vein crosses the medial palpebral ligament about 8 mm from the medial canthus. This is important while doing the diagnosis DCR surgery, because if you injure the angular vein, there will be severe bleeding. So you should be very careful while doing DCR, diagnosis rhinostomy surgery. So anatomy of angular vein is very important. Angular vein, which causes the medial palpebral. This is the medial palpebral ligament. It is about 8 mm from the medial canthus. It is situated at a distance of 8 mm from the medial canthus. Nasolacrimal duct, it continues downwards from the neck of the lacrimal sac to its opening in the inferior meatus of the nose. Its direction is downwards, backwards, and laterally. The direction of the nasolacrimal duct is downwards, backwards, and laterally into the inferior meatus of the nose. The length of the nasolacrimal duct is about 18 mm in length and diameter is about 3 mm. The upper end is the narrowest part. The direction of the nasolacrimal duct is downwards, backwards, and lateral. It is divided into two parts: intraosseous part, which is about 12.5 mm, and intrameatal part, which is about 5.5 mm. The nasolacrimal duct is divided into two parts: intraosseous part and intrameatal part. The size of the intraosseous part is about 12.5 mm, and the intrameatal part is 5.5 mm. The intraosseous part lies in the nasolacrimal canal, which is found anterolateral by the maxilla and posteromedially by the lacrimal and inferior nasal concha. The intrameatal part of the nasolacrimal duct lies within the mucous membrane in the lateral wall of the nose, whereas the intrameatal part lies in the mucous membrane in the lateral wall of the nose. The lumen of the nasolacrimal duct is marked by numerous folds of the mucous membrane, the so-called valves. These folds of the mucous membrane are called the valves. Of these, the most consistent is the valves of Hasner situated in the lower end. This is the Hasner valve, which prevents deflux of fluids from the nose into the lacrimal sac. That valve is called valve of Hasner. This is the Hasner's valve. It opens into the inferior meatus, prevents the reflux of fluid from the nose into the lacrimal sac. Blood supply. Superior and inferior palpebral arteries, the branch of ophthalmic artery, arterial supply, angular artery, infraorbital artery, nasal branch of the sphenopalatine artery. Venous drainage occurs into the angular vein, infraorbital vein into nasal vein from below. Lymphatic drains into submandibular and deep cervical lymph nodes. Sensory nerve supply to the lacrimal sac and nasolacrimal duct comes from the infratrochlear nerve and superior alveolar nerves. Sensory nerve supply comes from the infratrochlear nerve and superior alveolar nerves. Applied anatomy, dactylitis occurs occasionally in infections like mumps, influenza leading to suppuration. It produces red, painful swelling with redness in the outer one-third of the upper eyelid. Dactylitis produces red, painful swelling with redness in the outer one-third of the upper eyelid. Mikulicz syndrome, it is characterized by the symmetrical enlargement of both salivary and lacrimal glands. It is lymphatic in nature. Symmetrical enlargement of both salivary and lacrimal glands is called Mikulicz syndrome. Dactylitis is the cystic swelling in the upper pharynx due to retention of secretion due to blockage in one of the lacrimal ducts. Dactylitis occurs occasionally in infections like mumps, influenza leading to suppuration. Dactylocystitis, it is inflammation of the lacrimal sac. It may be acute or chronic. Acute dactylocystitis is a lacrimal abscess, may be due to acute inflammation of the lacrimal sac. The skin over the swelling becomes red and swollen. There is severe pain and fever. Chronic dactylocystitis is more common than acute dactylocystitis. Main symptom of chronic dactylocystitis epiphora or watering. There may be swelling at the site of the sac. On pressing over the swelling, the mucus or pus regurgitates through the punctum. On pressing over the sac, you can see the pus coming from the punctum. That is the feature of chronic dactylocystitis. Whereas acute dactylocystitis presents as a reddish swelling. The skin over the sac becomes red and swollen. Sometimes there can be pain and fever. Whereas chronic dactylocystitis, the predominant system is watering or epiphora. Once you press over the middle part of the eye, you can see the pus coming up from the punctum. That is chronic dactylocystitis. This is acute dactylocystitis, where you can see redness and swelling over the lacrimal sac, and there will be severe pain. Sometimes fever can be. Epiphora may be due to increased production of the tears or decreased outflow of the tears. May be caused due to eversion of the lower punctum or occlusion of the punctum, occlusion of the canaliculus, or congenital anomalies of the punctum and canaliculus. There are causes for epiphora or watering. either due to increased production of the tears or decreased outflow of the tears. It is caused by the occlusion of the puncta, occlusion of the canalicus, or congenital anomalies of the puncta and canalicus. Lacrimal obstruction commonly occurs at the junction of lacrimal sac and the nasolacrimal duct. Obstruction occurs usually at the junction of lacrimal sac and nasolacrimal duct. Chronic inflammation leading to fibrosis and stricture is the commonest reason for the block. This is a picture of acute dacrocystitis where you can see the redness and swelling over the lacrimal sac. There will be severe pain, fever will be there. This is a picture of dacrocystitis. All these four are pictures of the dacrocystitis. It is divided into acute dacrocystitis and chronic dacrocystitis. This is the fascia covering the lacrimal sac. This is the lacrimal sac and nasolacrimal. This is the fascia covering the lacrimal sac. The periaorta, it splits at the posterior crust and fuses at the anterior crust. The angular vein crosses over the medial palpebral ligament at about 8 mm from the medial canthus. This is the important thing while doing surgery on the lacrimal sac, because if you injure the lacrimal sac, there will be profuse angular vein, there will be profuse bleeding. So anatomy of the angular vein is very important while doing dacrocystorhinostomy or dacrocystectomy. This is the orbital part of the lacrimal gland, and this is the palpebral part of the lacrimal gland. These are the ducts which pass through the palpebral part of the lacrimal gland and opens into the superior fornix. From there, the tears drain into the puncta, superior canalicus, inferior canalicus. From there, they drain into the common canalicus, into the lacrimal sac. This is the fundus of the sac. This is the body, and this is the neck, and this is the nasolacrimal duct. These are the accessory lacrimal glands. These are the glands of Praze, which are located in the superior fornix. Opens into the superior fornix, subconjunctivally. They are located. These are the glands of Wolfing. They are located above the tarsus, superiorly above the upper tarsus, inferiorly below the lower tarsus. These are about 40 to 40 in number in the upper fornix, glands of Praze. 18 number in the lower fornix. Glands of Wolfing, they are about 2 to 5 in number, both upper and lower fornix. They are present above the tarsus. They are the accessory lacrimal glands, glands of Praze, glands of Wolfing, intraorbital glands, glands in the caruncle, and plica subclavian. They are the accessory lacrimal glands. Nerve supply is by the lacrimal nerve, which is a branch of ophthalmic division of the fifth nerve. Lymphatic drainage is into the preauricular lymph nodes. Lacrimal gland, the drainage of lacrimal gland is into the preauricular lymph nodes. And blood supply is by the lacrimal artery, which is a branch of ophthalmic nerve. Sometimes branch of the transverse facial artery may also supply the gland. This is the microscopic structure of the lacrimal gland. It consists of ducts, ductules, and acini. These are the acini. Dark purple pink structures are called acini. Each duct is divided into multiple ductule, and each ductule is divided into multiple acini. Each lacrimal gland has two surfaces, two borders, and two extremities. The superior surface is convex, inferior surface is concave. Inferior surface lies on the LPS muscle. The anterior border is sharp, and posterior border It is round and becomes continuous with the orbital part. Lateral extremity lies in the lateral rectus muscle, whereas medial extremity it is related to the LPS. This is the orbital part of the lacrimal gland. This is the palpebral part of the lacrimal gland. This is the LPS muscle separating the orbital part from the palpebral part. These are the ducts which travels through the palpebral part of the lacrimal gland and opens into the superior fornix. This is the punctum, which is situated about 6 mm away from the medial. This is the medial canthus. This is the caruncle. It is situated about 6 mm away from the medial canthus. Both this is the upper punctum and this is the lower punctum. Both of them are situated roughly about 6 mm away from the medial canthus. The length of the lacrimal sac is about 12 to 15 mm. Canalicus is about 10 mm. Nasolacrimal duct is about 12 to 18 mm. The reflex of fluid from the nose into the lacrimal sac is prevented by the valve of Hasner. This is the valve of Hasner, which is junction situated at the opening of the nasolacrimal duct into the inferior meatus. This is the valve of Rosenmuller, which prevents reflux of the fluid from the lacrimal sac into the canalicus. The valve of Rosenmuller is situated at the junction of opening of the common canalicus into the lacrimal sac. This is called the valve of Rosenmuller, and the inferiorly, which is located at the junction of opening of the nasolacrimal duct into the inferior mid-hiatus, is called valve of Hasner. Valve of Rosenmuller and valve of Hasner. The pictures of dacrocystitis, acute dacrocystitis, severe redness and swelling over the area of the lacrimal sac. You have to treat with oral antibiotics and anti-inflammatory drugs. Epiphora means watering of the eye. The causes include occlusion of the puncta or occlusion of the canalicus or congenital anomalies of the puncta and canalicus. This is about the anatomy of the lacrimal apparatus. Do you have any doubts? This is the orbital part of the lacrimal gland. This is the palpebral part of the lacrimal gland. They become continuous with one another, orbital part and palpebral part. Anteriorly, they are separated by the LPS muscle. This is the LPS muscle, which is separating the orbital part from the palpebral part anteriorly. But posteriorly, they are continuous with one another. They are the ducts which pass through the palpebral part of the lacrimal. This is the caruncle. This is the vertical part of the canalicus. This is the horizontal part of the canalicus, which opens into the lacrimal sac. This is the anatomy of the lacrimal apparatus. Be steady, and if you have any doubts, you ask me in the next class. Okay.